It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Jim Knox along with Candace Kruger, and we welcome you back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Houston area that help change people's lives.
That's right, Jim. Like our first doctor, it's bariatric surgeon, Dr. Robert Marvin.
I was extremely overweight. I was tired all the time. I was a mother of 4. I couldn't play with my kids. I just felt horrible.
Deborah's a younger person. She was morbidly obese, but she was in the lower range for morbidly obese. And she didn't have a lot of other medical problems, and she had her surgery 17 months ago or 18 months ago.
I had the gastric sleeve done, and I decided to have the sleeve done because I'm a nurse, and I had researched the lap band and also the gastric bypass, and neither one of those were really an option for me in my lifestyle. So that's what made me decide to go with the sleeve.
Since then, she's lost all of her extra body weight. She's
overweight has on you, it's just tremendous. It's a tremendous strain on you, your family. Whereas with the surgery, you do it and within a week, you're already losing weight, you're feeling better, you're recovered from your surgery, and there's nothing to lose by doing this procedure except for weight. And you gain your life back in return, so it's absolutely amazing.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a 3-dimensional standpoint radiographically ahead of time so as to know where the bone is so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall costs significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's just satisfying to see them come back smiling, see them walking down the hallway, standing upright with their chin up, smiling and being much more confident. So it from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, Pam is here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
As always, the Best Docs Network is all about amazing doctors changing people's lives. Like our next doctor, it's plastic surgeon, Dr. Lucien Rivella.
Here at Rivella Plastic Surgery, we perform plastic and reconstructive surgery. We emphasize aesthetic procedures primarily of the breast, body, and face. The ideal candidate for a breast lift would be a woman who's completed their childbearing, their breast changed during pregnancy or during lactation, and they have perhaps stretch marks, excess skin, and they've lost a lot of the fullness in their upper part of their breast. So typically they're going to want everything lifted as if what a bra can do for them, and that may involve an implant or without an implant.
After birthing 3 children, I needed some help, so I came and saw Dr. Rivella. I knew some people in the area that have had his work done, or had work done by him, and so I was pleased and came to see him as well.
Amy came to us with sagging breast and after children. She wanted them uplifted. She wanted to be able to wear certain tops and clothing that look perky without being saggy, and having to wear special undergarments that were cumbersome or bulky. So what we performed was uplift with implants, and she's turned out very nicely, and she's happy with the results.
I had friends that after I had it done looked like I had lost 10 to 15 pounds, and I had done nothing different with my eating or anything. It was just the way that the top of me was carried before versus after.
It's a fairly quick recovery after a breast lift, and it takes maybe about a month to 6 weeks to get back on your feet feeling like like you did before.
The entire office staff is wonderful. They are all very helpful. He's super nice. He is very informative, very helpful. We'll take your calls if you need to ask him any questions. He is there if he can't answer them. His nurses are there and available to you, but he is great as far as explaining everything and being there when you come out of your procedure to make sure you're okay. Yes, I would recommend Dr. Rivella. He is wonderful as far as his help and the courteousness of his staff, and his results are fantastic.
Most people want to lose weight. Obesity and being heavy is bad. It can cause 26 different kinds of cancer, as well as hypertension and arthritis. So how do you lose weight? Well, it's difficult. First of all, get rid of the soda pop. People who drink soda pop for some reason gain a lot more weight than you think just from the calories. And drinking diet soda doesn't help that much either, because it stimulates your appetite even though it's lower calorie than the regular soda pop. So cut down on the pop, and you'll cut down on the pot belly too. Secondly, fall in love with a sport. If you fall in love with some exercise routine, then you'll do it, and you won't find a reason not to do it. Sometimes it helps to have a partner who will make you go walking or go to the gym in case you don't. So get involved with a group, or even get a trainer. Programs like Weight Watchers is a great way to lose weight. They're very disciplined, and the only thing I've ever seen that really results in long-term weight loss. Many diets help, but then people just fall back into their old ways. Weight Watchers has a good thing about it, and also you can do it online. So get rid of the soda pop, fall in love with a sport, eat right, Eat what your mom said eat. She knows. Less fat, less sweets.
Minnie presented in my office complaining of a painful bunion deformity. A bunion deformity is that deviation of the great toe where you see that bump on the side or bump on the top. It has to do with a deviation of the first metatarsal, and basically, you know, it just became really painful for her to walk in her regular shoes.
Yes, because I really had this bunion, I think like probably about a year. And so it had got so bad I couldn't even wear a shoe, so that's what really made me came in, you know, to have surgery on it.
The next step was for us to take an x-ray and to evaluate her foot and determine what kind of, you know, surgery would be appropriate. So after looking at an intermetatarsal angle, we basically decided that an Austin bunionectomy would be the best procedure. And so that's what we ended up doing.
After I had the surgery, I felt much better, you know, no pain, you know, it just felt better. And I was so happy, you know, to get it done.
I mean, as long as you address the underlying etiology, the cause of it, then you're not going to get a recurrence, and it's wonderful. I mean, you know, people suffer from painful bunions all the time. It can be painful to the point that you can actually develop an ulcer at the side bump, because first it gets red, and the next thing you know, you have a wound. And that can be problematic, because then you can get an infection to the bone.
I mean, it's not sore or nothing, it just feels better. And so he really do a good job, and he makes me feel comfortable. I mean, he's a real good doctor.
Bunion surgery has a bad knock to it. You know, a lot of people are concerned that they've heard from, you know, their neighbor, or they know someone at work who's had the surgery and it's extremely painful. I have some patients that have zero pain from the bunion surgery, but I can keep the area numb for 3 days with a pain pump, which is a device that just gives continuous drip of local anesthetic and keeps it nice and numb. Because really, inflammation is the first part of wound healing, and that's in the first 72 hours, so the first 3 days. It's a great relief for patients. Really, 2 weeks of just not putting weight on it, and you know, we've really come a long way with our surgeries.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
I started having heavier periods where I would have to, you know, make sure that I was near a restroom, and, you know, kind of got to be about every hour to 2 hours, I would have to check, have excessive bleeding, and so I would not, you know, wear anything that would, you know, have the ability to, you know, show any type of accident, which again is very embarrassing.
It's a very common problem. It affects about 1 in 5 women. A lot of women think they just have to put up with it, and that's part of being female, and sooner or later it will stop. But in fact, it goes on for a long time, and it interferes with their work life, their exercise life, their sex life.
And it started getting irregular too. It wouldn't always be every 4 weeks. I mean, sometimes I would have it 3 weeks, sometimes 5 weeks, so I couldn't even anticipate if we were going on a trip or, you know.
Again, in the old days, 10, 15 years ago, it was very common for the gynecologist to say, well, let's just do a hysterectomy. This new minimally invasive technology was developed called endometrial ablation, referring to ablating or removing the lining of the uterus.
And Dr. Leibman gave me the alternatives and said it's a very short procedure. I trust him wholeheartedly. I mean, I've known him for, you know, 20 plus years, and I would trust my life with him.
She certainly didn't want to have a hysterectomy. So when we talked about this minimally invasive procedure that involved no cutting, no hormones, she was really interested.
And so came in here, cannot stand needles, cannot stand any procedures. I was in and out of here for sure in an hour. And I mean, obviously I did get put under.
The recovery is very similar. It's going home, taking a nap, having some pain medication, and usually that night there is some cramping, but the following day almost everyone is up and about and doing what they need to do.
And went home, slept for maybe a day off and on, and I was back at work the next day. And ever since then I been perfect and feel wonderful.
For more information on any of the amazing doctors you've seen on today's show, just go to our website. It's bestdocsnetwork.com.
That's right, bestdocsnetwork.com. That's the place to go to find one of the top doctors. Right now, the place to go is our next best doctor. It's ear, nose, and throat doctor, C.T. Nguyen.
Originally, I was having a lot of sinus pressure. Pretty much all the time I had sinus pressure. And I had a lot of headaches. I would have sinus infections pretty much back to back. I'd have several sinus infections a year.
Amanda has consulted multiple Ready Clinic urgent care that does not really address her problem. All they did was to refill her prescription of antibiotics, gave her some antihistamine, and tell her to go home. But what they do is they treat her symptoms instead of treating the cause of her problem.
He basically just looked at my nose and kind of tried to figure out what the problems were based on the symptoms. And he noticed immediately that my turbinates were really big.
The inferior turbinate is a normal structure in your nose that everybody has. It has a role of filtering and humidifying the air that you breathe in. So it becomes enlarged and inflamed when it is irritated by either allergies, infection, or pollution in the air. Considering her busy schedule, we decide upon a two-pronged approach treatment. Balloon sinuplasty in office to treat her sinus issue, and inferior turbinate reduction to relieve her nasal obstruction.
I don't really have any more sinus issues. I haven't had a sinus infection since the surgery, and it's been a few months now.
The advantage of balloon sinuplasty is that it can be done in office. There's no general anesthesia. The cost is less than doing it in the hospital, and the recovery time is really quick. There's really no downtime. The patient can go back to their daily activities quickly.
It's actually kind of funny. There's a lot of things that I didn't realize were issues until after the surgery. I know one time I was sitting in my bathroom and I was sitting there and there was a candle about 2 feet away from me and I actually could smell it. And that was something that I have never done before, and it kind of just hit me. I was like, I can actually smell the candle.
Dr. Meredith Morgan is one of the best physicians in helping women manage menopause. Practicing for over 35 years, Dr. Morgan, as you see, has a unique office. It's located in the Museum District, a freestanding facility with a relaxed atmosphere. Today's topic, perimenopause.
It's really important to understand that this is a normal process, and it happens with all women. It starts in their mid-40s. The average age of onset is 47, and on average it lasts about 4 years.
According to Dr. Morgan, perimenopause represents a change. Women will experience a number of symptoms.
This is a time of relative estrogen deficiency and brings on mind, mood, memory, and even sleep disorders and irregularities. Yes, there are hot flashes and night sweats that most women think of as menopausal, and yes, they can be just as severe as the postmenopausal ones. But the differentiation between transitioning and a non-cycling constant state is the unpredictability and uncertainty that can be so distressing to a woman.
For women experiencing perimenopause, Dr. Morgan outlines the next step.
We have 3 levels of management. The first will be basically lifestyle adjustments and home remedies. The second is non-hormonal medical prescriptions, and the third is hormonal management. We want to treat at the lowest dose for the shortest duration, consistent with what the need is. We have to understand it's important to use what is acceptable to the woman herself. In my mind, without a doubt, we've taken a step forward for the city of Houston and its surrounding environments. We've developed a site that is comfortable and convenient, that provides medical center quality with minimizing the hassle that's involved. It's been very rewarding to have done this for the last 10 years, and I'm looking forward to the next 10 and 20 years in continuing to do and help women throughout the entire region.
Don't forget, for more information on any of the great doctors you see on today's show, you head to the website bestdocsnetwork.com, bestdocsnetwork.com. Check out some of the fantastic, outstanding work by some of these doctors in the Houston area. Right now, it's time to head to our next best doctor. It is Dr. Stephen Rhodes.
After having met with Dr. Rose, toured the facility and saw the importance of the work on the early detection side, I was compelled to do something more. It's kind of like once you have knowledge to do something, then you have to move forward and make sure that others know about it as well.
There are several things that we're looking for the foundation to do. One is to continue to fund important research. There's always going to be more things that we can learn and do better. The number two thing is to be able to educate both other physicians and the community, especially the community, so that people begin to understand and participate in the process of screening. Because the sad thing is, in recent years, screening mammography, especially in younger women, has decreased. And now I see women show up who haven't had their mammogram and they have more advanced tumors. I hate seeing that. We also want to try to be able to raise enough money to do more indigent care as well for those who need additional care. So those are the three main areas we're targeting.
What I love most is the fact that we're educating other radiologists to read these mammograms so that we can spread the word quickly, and also the amount of anxiety that the results of these tests provide.
Very few people really realize that almost all of the breast cancers are detected in the community. They're not detected at facilities like MD Anderson for the most part, because most people are referred with the diagnosis there. So the research foundation was based on that idea that we could fund research in the community and do things that weren't being done elsewhere.
Our work is so important. I feel that we can take a big bite out of breast cancer incidences if we can move forward with this early detection. Women who are vigilant about having their mammograms annually using a 3D tomosynthesis procedure can certainly help themselves. And not just for women who are insured, but we would like for every woman to have this available to them.
Tiku broke his jaw growing up and his teeth never lined up until he met oral surgeon Dr. Paul Metz. To find out more about Tiku's story and other life-changing stories, log on to bestdocsnetwork.com.
The reason why I chose breast augmentation was because my breasts were smaller than all my friends. I had the smallest ones, and it was never fun wearing a swimsuit. And
Megan came to us looking for breast augmentation, and it's a surgery that allows her to fill out her clothes, fill out the fashions that are popular, and have more confidence in herself and her appearance.
When I was trying to figure out the size, I didn't want something that looked fake. I kind of wanted to look natural. And
with the breast augmentation, we'll see someone for an initial consultation, and then after the initial consultation, you'll have a preoperative visit. And the surgery itself, they'll come in that morning, they'll meet with our nurses and our anesthesia staff, and then the surgery itself takes about an hour.
I got the breast augmentation done on Friday, and I returned to work on Tuesday, and I really didn't take the medication as much as I should have, which was fine because the procedure, I healed pretty quickly.
I think in general, the ability to have an operating room in our office allows us to control the entire experience. And so from the second you walk into the office to the second you leave, and you're seeing your 3rd and 6th month follow-ups, the experience is controlled by myself and Dr. Bancroft. The Quad A SF is the gold standard for outpatient ambulatory surgery centers to be credentialed in and accredited by, and so we have voluntarily have gone ahead and gotten certified. Unlike many other surgeons who do it in an unaccredited or non-accredited facility, you just don't know how safe it is to do it there, and they may be very capable or they may not have all the equipment they need.
I feel a lot more confident in myself. I feel better when I wear clothing. It's more fun to put clothing on.
Patient selection is important, and making sure that your ability to deliver results are in line with their expectation. If their expectations and your expectations are aligned, they're extremely pleased with the surgery and being able to do it in the office in a comfortable environment where they're familiar with the office staff. And so as long as you select the proper patients, then patients are very satisfied with breast augmentation or any of the other surgeries we're able to do in our office.
Depression is a very common and a very bad disease. It's different than sadness. Sadness is what happens when you go through bad times in life, and it just tends to come and go in all of our lives. Depression is an abnormality of the chemicals in the brain that brings on a lot of bad symptoms and often needs treatment with medications. The two main questions you should ask yourself to decide if you're depressed are these. Number one, have I felt hopeless and sad for most of the time in the past 2 or 3 months? And number two, have I lost my interest in those things that I usually get a charge out of doing? For example, ball games with the kids, movies, certain meals, certain things on TV. If you've lost your joy in life, that's a sign of depression, and it needs to be treated. What can you do about depression if you have it? Well, you can do a lot. You can take medication. There's a lot of medications that work, most with few side effects. Exercise helps, getting adequate sleep, and counseling also helps. So there's a lot of ways to go from sad to glad.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Hair loss has many causes. 90% of hair loss is the genetic type that we see men balding. Females will get it as well. A small percentage have immune-mediated hair loss and scarring hair loss. We do a lot to try and screen those patients and treat them in other ways because they can't be candidates for this procedure. Well, FUE is the extraction of a follicle unit one by one. It involves careful aiming of the device at the unit and extracting it one by one. It's very time-consuming and tedious, but done properly, it allows for great healing and great results. Again, the other method is a giant scar, ear-to-ear incision, very, very bloody and fast. It's fast and easy, but it's just a horrible thing for the patient to go through. Versus this method is much more delicate, intricate, and overall the results are great. If you're talking about FUE and it's something you're interested in doing, you need to have at least a good amount of area in the back of your scalp to donate. It's the same criteria as the strip surgery criteria. The important things are things you shouldn't have or should try, or if you're considering, you don't want to be a patient with a lot of medical conditions. You can't really be on a blood thinner, you can't be a diabetic, you can't really have thyroid disease. Now, that's not to say that if you have these, you can't do the procedure. There are people who have these conditions that do the procedure, but your odds of success are much lower. In general, you want it to be an overall healthy person who undergoes this procedure. It is elective, it is cosmetic. The recovery time for this procedure is dramatic compared to the other procedure. The other procedure, you'd have this giant stitch that was painful and would stay in for 2 weeks. In this procedure, usually you have a Band-Aid on the back of your scalp. Band-Aid comes off in a day, maybe 2 days, and you can go back to work the next day. If you're okay with the Band-Aid, a lot of people are. They just get a Band-Aid, go to work the next day, and it's like nothing's happened. There are other ways to do this. They're not permanent. Whatever you do, you're going to do it every day versus our method is permanent. But we like to make sure the patient's informed about their options before they actually undergo this procedure. Now, once you do this procedure, you're done. There are no pills, there are no creams, there are no topical medicines, and you have your hair. You go swimming, go do whatever you want with it.
That will do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the entire Houston area that help change people's lives.
Yes, and for more information on any of the amazing doctors you've seen on today's show, just go to our website, bestdocsnetwork.com.
That is the place to go. And don't forget, if you have a question or comment for us, hey, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
That'll do it. Thanks for tuning in.
So long, everyone.